it's a massive disappointment for the country. 2 million doses of the Johnson & Johnson COVID-19 vaccine ready and waiting at the Aspen factory in Gqebehra in the Eastern Cape have to be destroyed. This after the US Food and Drug Administration announcement on Friday that the vaccine batches from the Emergent BioSolutions factory in Baltimore have been contaminated. But of course, President Cyril Ramaphosa, speaking on the sidelines of the G7 summit in England, says the factory in the Eastern Cape is ramping up production to produce more batches. Aspen Pharmacare says it hopes to have new doses ready this week. And to tell us more, I'm joined by CEO Stephen Saad. Thank you so much for joining us. When you heard the news on Friday that you might have to destroy those batches, what did you think?
It was an extreme disappointment. I think that's a small word. We were hopeful. We'd seen the results. We'd sort of been given. We'd had some sense that things weren't as bad as it seemed, but it would appear that the regulators, of course, had deferred to the most conservative position. And so, what we had done is what did I think? I was extremely disappointed. I was very sad for teams that had worked so hard, both at Johnson & Johnson and Aspen, and to think that there were 2 million doses sitting in a fridge waiting to be dispatched. I mean, Friday was not a great day. But in life, you take a knock, you get up, and you need to find another plan.
Yeah.
And I'm happy to say we found it, Sally. I think we've got a great plan for South Africa. We've got...
I'm looking forward to hearing about that plan. Sorry to jump in. I just want to dwell on the 2 million. Sorry, Stephen. Is there actually confirmed contamination of the 2 million doses in the Eastern Cape? Or are they actually being destroyed as a precaution, as there was no guarantee of good manufacturing practice?
That's it. If you look at the lab test, there was quality and safety was okay. But you're right, it was extreme caution. There was no contamination found in those particular batches.
How do you destroy 2 million doses? I mean, they're all filled and finished now in their little glass vials. Are you just going to burn them? What do you do with them?
No, it's a special process. There's a special process to get rid of biological product, but they cannot be used. I mean, that's the bottom line. And I think given the vaccine and vaccine skeptics out there, I think it's the right call.
Yeah, you're absolutely right. We don't need any hint of concern about these batches. I want to talk to you about the costs of this failed production. Do you have an idea of how much it has cost? And who will bear that cost? Is it Emergent BioSolutions, Johnson & Johnson, Aspen, or even in part the South African government?
So there's two costs here. There's a financial cost. So Aspen and the South African government will bear no part in that cost. That cost would either be borne by J&J, Emergent, or the insurers of either company. But the cost for me it's not really about whether Aspen lost money or made money or whatever they did out of this. The cost really was the potential risk to the momentum of a South African program that has stalled a little bit and been unfortunate given what happened with AZ, etc. The potential risk of not getting a sort of a one-shot dose into the public and really getting the people vaccinated in a hurry.
Right, that it's good news, certainly, that there's no financial toll for Aspen or the South African government, but it's that loss of momentum, that crucial loss of time as we move into the third wave as a country. But I know that you've told the President that you've got a plan B, thank goodness. Talk to us about that plan B, where you're getting the base ingredients to fill and finish in the Eastern Cape.
Yeah, so we obviously realized there was an issue because we've had those vaccines waiting since the end of April. Let's not forget that. Certainly the first batch of the first 1.1 million odd were there waiting at the end of April. What J&J decided together with us was we brought in other material that came from a European supplier rather than American supplier Emergent, who had the problem. And we started making that just nearly about a month ago. And we continued to make those batches. One of those batches come off our line within a week, so before Monday of next week. And so part of that will be part of what we supply. But, the positive is, we've had a great relationship with J&J, have shown real commitment to Africa. One, just supporting Aspen in terms of capacitating Africa. But two, when you have a real problem like this one, they've really stepped up to the plate. So, I mean, their commitment has been that, the 300,000 doses will come for our teachers, and that's a critical thing, is to look after our teachers, given the importance of education for our children. So they are bringing those in the next few days. There's 300,000 doses there. And their commitment together is to the 2 million doses that we've lost, to cover those 2 million doses, one between or more, so at least. So hopefully we're going to get more, but at least the 2 million doses will be covered, one out of Aspen production and two out of other product that they will bring into South Africa that is unaffected by this contamination. So that, within 2 weeks or so, starting almost immediately, but over the next period of 2 weeks, we will have, the couple of million doses plus that we've lost, to be able to really speed up our vaccination program. And I mean, as you can see, and as we've seen as a country, what's happening in Gauteng and some of our other provinces is not good, and we really need to get this vaccination out as quickly as possible.
Yeah, you're absolutely right. It is such an extremely concerning time. You've given me a lot of information. I just want to drill into some of it. Am I correct that you said a month ago you realized this could be a possibility that you might have to make a plan B, and that by next Monday your first batch will be rolling off the production line? How big is that first batch?
So our batch sizes are about 1 million or so, just over 1 million doses. So together with the J&J commitment is to make sure that South Africa is made good and more. They've made a real commitment not only to South Africa, to Africa. I think from a selfish South African perspective, we will lose no momentum. We're in a positive space. The last 72 hours, we found the plans and solutions for the country.
Right.
But, as Aspen, we look more broadly. Of course, we look globally, and we've got to supply globally. We're supplying Korea and Canada and Europe and many other territories. But I must tell you, our heart is very focused on the continent, and to make sure that our other countries in Africa are properly supported. That is where our passion is, and, we're working very closely with J&J to make sure that we get this to Africa. Because come July, we've got all of this which solves short-term problems, but then we've got more of this European material that will come off our lines during July. And so it's critical that we look after not only South Africa, but Africa as well. But I think from a South African point of view, we're in a very good position now to be able to roll out as many vaccines in the short term.
So 1 million batches by next Monday. Is that all destined for South Africa? How many days thereafter, in terms of whatever process those batches have to go through before they can actually be released to the different vaccination sites?
So we've got about 300,000 vaccines that are arriving for our teachers. Either they've arrived tonight or they get there tomorrow, so it's just a matter of the transport. So it's literally here. Those are the first 300,000. The next couple of million, including the Aspen products. So Aspen products will probably come within a week, but there's another 1 million plus potentially coming, which will come out of the J&J supply system, which could start coming from will be no later than the next 2 weeks. So they could start coming in the next few days as well. So I think we're in a position where we're going to have sufficient vaccines, millions of vaccines really over the next couple of weeks. And that's equivalent to if you've got to double that to work out what you're going to get in terms of efficacy from other vaccines. So it's a big boost to the South African program. And once those vaccines are used, before they be used, we'll be in a situation to provide further batches out of our facilities in July. And, J&J are committed with us. Our focus right now is that we believe we have South Africa really well covered, and we're working closely to see how we manage the rest of Africa.
All right, so let me just get this straight. Those 300,000 doses for the teachers, those don't have to be filled and finished at your factory. Those are coming as a separate batch from Johnson & Johnson into the country. The 1 million doses are going to be rolling off your production line by Monday next week. And those, what happens to those in terms of safety checks? Do they have to go through a long process? How does it work? Sorry, carry on.
Sally, I should have told you that they're in the process of the safety checks. They have rolled off our lines. These were made about a month ago, so it takes about a month to run a batch start to finish. These were made about a month ago, just less than a month ago, but within the week it'll be about a month. And so at that stage, they're ready for release. So they are ready simply to get put on a plane to largely it goes to Midrand, and they're ready to leave our factories in the truck. So South Africa, I mean, forget about all the processes. Over the next 2 weeks, in the distribution chain, there should be a couple of million more doses of the single-shot J&J vaccine, in addition to what teachers will receive.
That is incredibly encouraging news. I have to ask you, you said that the solutions come from Europe. How confident are you that there are going to be no more safety problems?
You know, we've had a few knocks, haven't we, as a country? And, you know, as Aspen, we put our heart and soul into providing cover for the continent and for South Africa in particular, because our roots are here. We might be a multinational company, but our roots are South African. I'm very confident because the stock is sitting there. The stock has a drug substance that's positive, and we have the finished dose form without any material that's come from this facility in America called Emergent. So all in all, I've got a very high degree of confidence about where we are. You never want to say never, but I think that we're in a space now where we've done all we can, and we've ticked all the blocks, and it's really about getting the shots into the South African population now.
Well, thank you so much for bringing us such encouraging news after such a devastating blow on Friday. That was Aspen Pharmacare CEO Stephen Saad telling us that they've already manufactured 1 million doses of the vaccine using solution from Europe, which is completely sorted and safe. That is going through its safety checks. That is going to be rolled out within the next week. Plus, Johnson & Johnson is bringing in sealed, finished, ready to go 300,000 doses for the teachers, and there's more to come in the coming weeks. That's great news indeed this evening.